Greetings. Today I want to talk about the obesity pandemic amid COVID-19. Obesity has been a global threat to human health for over a decade. However, now it becomes more critical emerging public health problem with COVID-19. Obesity is a metabolic syndrome that causes chronic inflammation, and it can initiate other complications such as type 2 diabetes, heart disease, stroke, high blood pressure, and so on, and even cancer. The research shows people with obesity, BMI over 30, have over 113 rates of hospitalization. Admitted to ICU rate rise to 74%, and the death rate is almost 50%. People with obesity are most likely hospitalized with severe COVID symptoms, and those with comorbidity need more ICU care, including ventilators and more ICU beds. The surge of obese patients might overwhelm hospital ICUs and cause the collapse of the healthcare system. Obesity reflects on social inequality and poverty among the cities like Mississippi, Arkansas, and Alabama, where are the top high obesity rate cities. With this problem prevails, people can easily take social stigma and weight discrimination on people who are overweight or obese. My thesis statement is COVID-19 presents severe symptoms among the obesity population. Meanwhile, disease further weighs on obese individuals by worsening their physical, mental, and social health. Let's talk about physical health first. People with obesity obviously present body inflammation and the risk of complications such as diabetes, heart disease, HIV, and many other factors and illnesses. People with obesity have severe symptoms of COVID. That can be fever, cough, shortness of breath, or difficult breathing, fatigue, muscle ache, loss of taste, sore throat, runny nose. On the behavior side, people might stockpile food, overeating, which is binge eating, stress eating as well. According to THESIS online questionnaire with 128 obese participants, 70% of responders say they feel the weight loss goals because of stay-at-home orders. 48% of responders decrease their time of training, and 56% of participants decrease the exercise intensities. For mental health, people with obesity can suffer from the fear of getting COVID-19, being criticized by the public, anxiety, depression, or even stress out. Social health is one of the factors that influence people's mood, emotions, and mental health. People get used to social media, posts, feeds, news from websites. We can see lots of negative or vicious words, memes, and positive video to mock, denounce, make fun of people who are overweight or obese. For instance, the terms like fat shaming, quarantine 15 can create more distrust, separate people, and even make curse on people. The social stigma and discrimination become more common, especially the effect of severe COVID symptoms, putting obese patients into a position they don't want to be. Another issue is, do people with obesity need vaccine? The public expectation becomes paralyzed. It is a right to receive vaccine. However, the research shows obesity can impair T cells and T helper cells that cannot be protective in immune systems. And also another news from the Guardian also claims Pfizer vaccine has less effective antibody responses in people with obesity. The controversy comes with a correlation between obesity and COVID-19, but it cannot be collected by the exact BMI number. Some researchers claim not to lose weight during the home quarantine because unintentional weight loss might develop malnutrition and cachexia. America is a typical Western culture filled with fast food surroundings. Depending on the area people live and the socio-economic status can determine if this area have enough resources for healthy food and proper healthcare delivery. It's called resource inequity. People can lose their faith and determination on their goals during the pandemic. It can make people suffer from psychological behaviors such as eating disorders, binge eating with high calorie food. The cultural differences are the main problems in the obesity battle. American culture tends to be sedentary behaviors such as drive-through, long driving to work, and sitting. Compared to lowest rate 3.6% of obesity in Japan. People in Japan often walk to work, standing on a shuttle bus, long walk, and there's more option for people to choose for food. People can eat healthy food such as natto, seafood, miso soup at a cheaper price than fast food. And even in the convenience store, people can have a decent amount of nutrition intake. The research shows sugar tax had a little impact for a customer choosing sugar-sweetened beverage because most Americans are addicted to sugar for years. One of the strategies in UK that America can apply is to cut 20% of calories in food industry. In community, it is always encouraged to continue to provide healthy food and educated quizzes for people to choose healthy food wisely. Also, people can learn to practice different diets, such as low-carb diet, protein diet, but people with obesity need to discuss changing diet with nutrition consultant. Another alternative way to decrease obesity is to do weight loss surgery. Content for types of bariatric surgery is gastric bypass, gastrotomy, adjustable gastric band, and BPDDS, gastric bypass. And also, all people have to follow COVID guidelines, such as you can decide to receive the vaccine, practice physical distances, wear a mask, washing hands, and sanitize to minimize the risk of COVID-19. So, obesity is a multifaceted disease and requires a commitment to have behavior change, which are balanced nutrients intake and physical activities. For consuming nutrients, one of the suggestions is to choose food with melatonin, such as plant-based food, seeds, fruit, and high amount of mineral and vitamins. According to research shows, melatonin can help people sleep and decrease stress, especially amid in COVID-19 pandemic. For physical activity, it's better to have a trainer or partners to support each other to exercise. It might be difficult to go out, especially lockdown rules. However, having a partner is one of the suggestions to keep exercising. A SMART goal is a strategy for planning out the details on which physical activity and components people want to improve. The categories include cardiorespiratory endurance, muscular fitness, and flexibility. Theoretical model is another strategy to encourage people to start awareness, start a plan, and maintain it. In the battle of obesity and the COVID-19 pandemic, the cost of treatment is unreasonable and unaffordable for people. First, to shorten the social inequity and healthcare delivery, it is important to have a budget in public field, and in order to promote national health insurance. For instance, Germany, UK, even Taiwan provide their citizens a decent health care by national health insurance. Also, we can predict and expect the development of cutting-edge e-health after this pandemic. COVID-19 pandemic is an emerging event that exacerbates obesity health problems. Not only worsen the symptoms of COVID-19, but the burden of obesity weighed on people's physical, mental, and social health. The government has a responsibility for promoting a better social infrastructure and education on nutrition intake and physical activity in order to bring out a promised nation. Thank you for your attention.